Come see us at Mercantile at the Ridge for unique fashions for men, women, and children. The same familiar location, new management, and a refreshing shopping experience with over 125 individual shops. Find what you're looking for at Mercantile at the Ridge, Ringgold Road, Exit 1, East Ridge.
This time of year, hopefully, you're planning to be active, getting out there, enjoying the beautiful summer weather that is ahead of us. But if you have some leg issues going on, it could be your veins, and you might not know where to turn. Well, we're going to help you this morning. Dr. James Gooden is on the show. He's with the newly opened Milligan Vein Clinics. They have locations other parts of Tennessee, but happily now, you're calling Cleveland home. So good to see you.
Thanks for having me. Yeah, we're real excited to be in Cleveland.
And you've got a local tie because you were affiliated with Erlanger for a while.
Go Vols, yeah. Pretty much all of my training has been done within the University of Tennessee system.
So you are a general surgeon,
I am.
But what y'all specialize in there at Milligan, as y'all put it, is tired, achy, heavy, restless legs.
That's
You're
right.
a leg man.
I am a leg man. And that's how our patients present. There's some misconceptions that veins disease is limited to varicose veins and spider veins and that sort of thing, and that's really only about half of the patients that we see. The majority of them present with pain in some form or another, whether it's just achiness.
So does that mean that if you have the pain, you're not seeing a vein issue, nothing is visible yet?
Not in everybody, but there are some telltale signs that you may not be aware of, but yeah. Sometimes, and the vast majority of our patients just have just that tired, heavy, swollen legs. They may chalk it up to just age. And really what we do is we treat these issues and really focus on improving our patients' quality of life.
Okay, let's say it is first of all, are most vein issues in your lower leg or your upper leg? Does it depend?
It depends, and it's really, without getting into the whole physics of the disease process, it has to do with pressure, and so the process involves the whole leg, but symptoms tend to be more prevalent below the knee.
It does involve pressure, so if you are on your feet a lot, if you're standing in place a lot, are you more prone to these problems?
Yes, it appears to be a correlation. People who have sedentary type jobs where they're standing a lot in one place or even sitting a lot in one place, not doing a whole lot of moving around, those are the patients we tend to see.
And did I dream this, or was I told once that for women, if you've had multiple children, you can be more prone to developing those problems?
Right, and that goes back to the whole issue of too much pressure in the veins. And we see that in women who have had multiple pregnancies. A gravid uterus puts pressure on the vein system in the body, and that can cause a bottleneck, which in turn increases the pressure in the veins in the leg.
Okay, so you talk about how you can treat it. First of all, y'all are treating it there in your office.
We are, yeah.
Which is helpful.
Well, the care that you receive at our clinic is comprehensive from start to finish, and whether it's doctor's appointments, your ultrasound appointments, your procedures, we do it all in-house.
So when you're treating it, is it a kind of the same treatment for everybody, or does it depend on what your particular vein issue is?
We use a lot of the same techniques from patient to patient, but everybody's treatment plan is an individual plan based on your workup.
Is it an actual surgery, or is it are you injecting something in? What are you doing?
We do injections. We also do radiofrequency ablation. These are surgeries. They're more minimally invasive surgeries.
Yeah.
If you go back many years ago, the main treatment for this type of issue was to find the diseased veins and to somehow get rid of them, either surgically remove them, through incisions. We do our work mainly through just needle work, needle sticks and running catheters through the veins, and we're able to do this without creating wounds, and much more comfortable for our patients in terms of post-operative discomfort. And so yeah, the majority of our surgeries are done endovascularly.
So we'll pretend on me for a minute. Just pretend that maybe I have one there. Is that a little vein on me?
Yes, it is.
All right, I'm not
call
shy.
that a spider vein.
Okay, so there's a little spider vein on me. If I didn't do anything with that, would it grow?
It potentially could, and it's
a little one.
Yeah, and that's sort of a stigmata of maybe there's a deeper problem that we need to work up and look at.
Right.
It's sort of It's just another sign or symptom of the disease process, which is involves the deeper veins in the leg.
You joked with me saying that the time would go by quickly, and it has. I have a minute left. But but the symptoms to be watching for aren't just the visible then. If your legs are tired, if they're achy, the restlessness, is that going to be at night?
It can be at night. That tends to be when it's most noticeable because people are, trying to go to sleep and being still. But that's exactly when it is, whether it's at night or during your day. It's any time really when we're trying to keep our legs still.
Right. Well, I kind of went to medical school with you for a few minutes, so
Yeah.
Thank you for the education this morning.
Thanks for having me.
Their office is now in Cleveland. They've come our way, and we're glad that they have. The phone number to call is 961-5682. It's Milligan Vein Clinics, because they do have multiple locations here in the Tennessee area. But don't take it lightly. If you've got these symptoms, you want to go ahead and nip it before it gets to be a problem.
Right now,
Come join our area's largest.
I injured my shoulder.
So Dad's out of town on vacation, and
right now.
Okay, Fridays.
is your backyard one of your favorite?
At Chattanooga
Now more than ever.
Is your backyard one of your favorite?
Local Sky 3.
So I'm sitting here having a conversation.
So here's the reality.
There's always an if and
Summer's here, and with an
When it's time to update your home.
I was up by the Ocoee when whether you're buying or
It's another beautiful.
St. Jude Dream Home Ticket.
It's the biggest Thrillville thing. Increase energy, boost your.
most kitchens have space.
Via Riverbend, VIP.
You know the saying, time.
A bed of Zaxby's.
Do you feel uneasy?
Life changed.
Who has the deals?
What is Zaxby's?
Thanks so much for watching.
You guys be careful.
This is Jay.
Is your old asphalt?
Tickets for the St. Jude Dream Home are now sold out.
Closed captioning provided.
Around here, we look.
Dad's still out of town, living it up.
Lead Guardian.
People ask us all the time.
Severe weather in our area. Count on Local 3 News for more.
Hello, Ryan Jack.
Chattanooga Dental Care, providing beautiful smiles for a lifetime. We offer quality cosmetics, sedation, and general dentistry for your entire family. A little bit nervous? Our sedation dentistry will fix that. Individualized care at Chattanooga Dental Care.